actually has 8 divisions, sometimes 10. It's just how lean you are, whether you can see the last couple that is very long. And there's some slight variation down here. We'll talk about that in a minute. Now, the sides of the anterior abdominal wall are separated by what's called the linea alba. The linea alba is made up of several different structures: tendons, fascias, peritoneums. All that makes up the linea alba. We'll get to that shortly. So, here on the sides, we have the external oblique. Most of y'all are probably familiar with that. It rotates the trunk, and when you get really lean, you guys can see the external oblique making its way down. So everybody stick your hands in your pockets, just each way one. Just like we do with the inner pocket. These are the external obliques. Cross your hands over. These are the internal obliques. Just like the internal and external intercostal muscles. They run, the external and internal run basically perpendicular to one another. But there's more to that. So covering, pardon me, the rectus sheath kind of sits down in a pouch. Thank you. Or the rectus abdominis sits down in a pouch called the rectus sheath. The rectus sheath is made up of the tendon, the anterior rectus sheath, or let me back up. The anterior rectus sheath is made up of the tendon of the external oblique and one half of the anterior half of the tendon of the internal oblique. So the two come together and surround the rectus abdominis. And then they come together along with the tendons between the two parts of the rectus abdominis to help form the linea alba. Now, deep to all of this, the rectus abdominis, the internal oblique, the external oblique, we have the transverse abdominis. Transverse abdominis wraps around you like a corset, or like a belt, like a big, thick weight belt. Corset, you ladies know what I'm talking about most of it. And what this does is help support the lower back. So when you're talking about core stabilizer muscle, you were actually talking about the transverse abdominis. Now, the transverse abdominis makes a tendon as well. And the tendon of the transverse abdominis and the posterior portion of the tendon of the internal oblique come together to make the posterior rectus sheath. And then the rectus sheath is sandwiched in those muscles. Now, I mentioned the core stabilizer. I want you to take a look at something right here. You see the transverse abdominis right there. You see the directions those fibers run. Transverse. Same thing. So, do you think doing a regular abdominal crunch is going to do much to strengthen that muscle? Back again. You're not even flexing that muscle whenever you're doing this. That muscle doesn't move that way. That muscle moves like it actually doesn't move much at all. So, to work on a core stabilizer muscle, this muscle attaches to the lumbar spine. So, to work on this core stabilizer muscle, you're doing a different type of exercise. This is also a very slow twitch muscle. Doesn't have a lot of power, but maintains very low grade contraction. Pretty much all the time. So when you're trying to target the transverse abdominis, you're doing exercises called like a bracing type exercise. So planks, that sort of stuff, yoga, that sort of stuff, where you're actually holding a position. And this muscle is actually what's contracting to keep things where it's supposed to be. I actually use exercise ball to work the muscle. And you do contractions on the exercise ball. Yeah, you do contract the rectus abdominis, but at that point the rectus is out of it, you actually stabilize yourself on the ball. guys who've never done it, let's see how you do that. Keep your feet together. If you spread your feet out like this, you're widening your base of support. You use your feet to support your torso. Those Swiss balls are exercise balls, as you guys know about. Were developed after World War I to help amputees learn how to walk with their prostheses. And they actually realized, even back then, that this is what supports everything from here down as far as movement and getting where you need to be and that sort of stuff. Some of you play sports. Some of you play maybe basketball or football or some sort of contact sport. Coach always told you to watch the belt buckle. Wherever the belt buckle goes, that's where the body's going to go. I had an uncle who was really good at doing this. He could look this way and run this. He could take us out of our shoes 9 times out of 10 in a lap when we're laying there on the ground, rolling around until we tried to tackle him and we missed him because we looked at his eyes. And he didn't tell us that for a long time. We were probably 10 or 11 years old before somebody finally told us. And he used to get the biggest kick. Oh, there's actually 2 of them before. And they used to get the biggest kick out of it. But wherever this goes is where the body's going to go. Now, does the head and the inner ear tell the body what's going on? Absolutely. The vestibular organs in the inner ear. But where this goes, the body goes. And you see this nowadays a lot of times, especially in football and stuff, they've realized that they need to train this with these guys, and that way you have decreased a lot of these lower extremity injuries. And as far as you all go, when patients come in with low back pain, there's almost always a muscular element of it. Just something to take with you. Now, the tendon transverse abdominis and the internal oblique also come together to help form the linea alba. So all of that linea alba is formed by all of these different tendons. Now, I know some of you ladies have children. Whenever you're pregnant, a lot of times, the linea alba will rupture, will separate. It's called diastasis reject. Because of the baby just stretching things and just more than what that tendon can hold, and it ends up rupturing. And they have to go back in there and stitch it back together. And it's usually fine. I have seen this in guys a few times that are serious power lifters because of all the increased abdominal pressure when you lift outside. It ruptures that as well. That's not terrible. All right, now here I notice here we got, this guy's got, 10? So he's got a 10-pack. Down at the bottom, he has a little variation. Not everyone has that. It's called pyramidalis. And it looks like a pyramid. If you don't have that, you never know about it. Unless some of you got really, really lean, you might see part of it down there to be able to see that. I'm talking about professional bodybuilder, Arnold Schwarzenegger type lean, like that kind of thing.
Talking about the V-line?
The V-line? Sometimes, V-line, yeah, it does make a V-line. But most of the time, you don't see that. It's almost always the way. So you can sometimes see that on somebody who's really, really lean. And if you don't have it, your guts aren't going to fall out. You would never know. It's not going to affect you. You have several little muscles like that. You have one in the elbow called the acromius. It's a part of the tricep. About half of you have it, about half of you don't. And if you don't have it, you never know. Your arm might fall. You have a muscle right here called coronary lungs. See that tendon sticking out right there? I don't have one this side. Take your fingers off the position and flex your wrist. You got the tendon pop out of your eye. If you don't, it doesn't matter. And as well. If I hadn't told you, you'd never know. Now, you probably got to looking around and realize one day things look different. You may look at somebody, sit beside you, my wrist looks different here. Don't look at those. Otherwise, I probably had one on the right in my younger days on power lifting. And didn't think anything about it. So anyhow, back to this. So front down here at the bottom. Now over the top of the anterior abdominal wall, you have deep muscle fascia, just like you do everywhere else except your face. So you've ever had a chick, and you pull the skin off of it, and you see that clear membrane across the meat. That's deep muscle fascia. You have deep muscle fascia everywhere except your face. On the abdominal wall, they call it Scarpa's fascia. But on the abdominal wall, you have an extra layer of fascia. And I got a lot called Camper's fascia. That is the abdominal fat in the anterior abdominal wall. I guess back 500 years ago when they were naming this, they didn't think it was polite to call it belly fat. That's what it is. They call it Camper's fascia. All right, so here we have, talks about everything I just mentioned. Perimedalis, right down here. Now, at the very bottom of the abdominal wall, this Scarpa's fascia is really thick. This finger's right here, right by your belt, there's no thumb sticking out. Have y'all talked about the pelvis shift, Dr. Lloyd?
No.
Okay, that's called the anterior superior iliac spine, ASI. Now, running from that down to your pubic bone, I'm not going to poke around down there. But you have a little piece of thickening of the fascia called the inguinal ligament. Inguinal ligament is there to keep all, it doesn't serve two purposes. It borders what's called the femoral triangle, which you'll learn about next week. Also helps support some of the structures of the midline, as well as keep the Camper's fascia up where it belongs. So you go over to your barbecue place lunchtime today, really good. Go to the barbecue place, look in there, about 12 o'clock, all the Bubba's show up. And some of y'all know where the Bubba is. I've been called Bubba most of my life. But they have these barbecue belts. And it comes out like this, but it always goes back up. Almost. So it comes out, you got gooch, and it goes back up. That's the inguinal ligament holding the abdominal fat in place. Now, sometimes that abdominal fat will herniate through that. It's called a femoral hernia. Actually, herniates down into the top of the penis, but that's very rare. You just stay right up there where it's supposed to, kind of like a girl. Hold it up. Yes.
So if you see somebody that's kind of like, I don't know the appropriate way to put it, kind of like sickly obese, and then just like hanging, does that mean that ligament is
A lot of times. Yeah, if the belly turns back up, no, but it just kind of slides
right
down.
on the side?
A lot of times.
Same process as when you're pregnant and running.
Hold on. You want to get above the belly, I can't do that.
So it's not like one
That
pair
bro's
and
not
then
chill,
back
bro.
off.
Carpenter be what is that? No, kill those things.
Generally not.
What's wrong with you? They don't do it.
They eat my house. That's what they do.
Oh, and you think your house matters? And
Absolutely. I love my
That
house.
doesn't matter, bro.
It's a wonderful house. And you know what? I'm gonna.
This looks terrifying. Bro, they're so good. If I get fuzzy, it makes it worse. Dog.
On the inside of the abdominal cavity, the inside of the abdominal cavity is surrounded with fascia. just like the thorax is, then we have the foot of the thorax. Well, down in the abdominal cavity, we have the yes, ma'am.
Well, I'm just saying, like, if it's hanging,
I just want to make the comment. I thought it was disrespectful because you never know somebody's situation. So you could be enough.
no, I entirely agree, yes, ma'am, but for the anatomy, I was just asking, is it just rupture where it's been painful, or does it just grow over time?
Generally, it just kind of works its way down.
I was just asking for the anatomy purpose, not.
So inside the abdominal cavity, we have peritoneum. Just like the thorax, just what it does is line the inside of the cavity. We have parietal as well as visceral peritoneum. Visceral peritoneum obviously is on the organ. Visceral peritoneum actually helps hold the organs in place, and we're going to talk about that after the midterm. But you have the parietal peritoneum lying inside of the cavity. Now, what happens at the bottom of the parietal peritoneum, right down here? You have to open where some vessels pass underneath. That's called the arcuate. Now, you have some vessels, and you have some structures, and you have some remnant of structures on the inside of the abdominal wall. First, we have right up here behind you have the superior and the inferior epigastric artery. Superior epigastric artery is a continuation of the internal thoracic artery we talked about a couple of weeks ago when we did stuff. Makes its way down across the backside of the abdominal wall to right here at the end. Then you have this inferior epigastric artery. Comes off an artery down the nose called the acromion. We'll talk about that a little bit. And what happens is it slips underneath this on this peritoneum right here at the artery. And then what happens is superior and inferior epigastric artery make what's called an end-to-end anastomosis. And you have a continuous arterial supply from the groin up to the subclavian artery. So continuous supply of blood. Like this. You also have veins, and they also have veins, so continuous veins. So you have both continuous artery and continuous vein. Allow a nice place of pathogens to make the way up and down. A lot of times, the inguinal lymph nodes, a lot of times will actually become enlarged whenever you have a throat or a pharyngeal mononucleosis. Causes the inguinal lymph nodes. And that's because of this. Well, now, you also have a couple other structures on the back side of this thing. They are not viable structures. So the first one we have is called the median umbilical fold. The median umbilical fold is not a viable structure. It's actually the remnant of what's called the ureus. The ureus, any of you have studied bird anatomy, that's the egg system of the bird. We obviously don't have an egg side. In our case, it is actually what's called the primitive bladder. In utero, you exchange waste products and nutrients to the umbilical cord. So the bladder is actually down here. And the ureus empties into the placenta and eventually makes its way into the umbilical vessel or the uterine vessel. And that's how you send it urine. Now, when you're born, lot of times, babies will pee through their umbilicus for a little while. This thing doesn't close up the instant you pop out. I remember taught this, that's kind of umbilicus pee. And you will see that it's a pretty common act, maybe for a half an hour, little urine trickle out of there. It doesn't go on for days. It's a little urine trickle out. So you actually pee out of your belly button. Then you have the medial umbilical folds. And they cover the remnant of an artery that's no longer in existence, called the umbilical artery. You don't need the umbilical artery. That's how you exchange nutrients with your mom through the placenta. And once you're born, that artery disintegrates. But because it's still underneath the peritoneum, it leaves a little ridge. And a little fold is there. It doesn't do anything at all. It comes off the branch of your pelvic artery, supplies the vitals, right? But it's just a nice little remnant when you're in your mom. And then you have the lateral umbilical fold, which is what covers the superior and inferior epigastric artery. Now, I'm going to over here some other stuff, so we're going to come back to it. Hold that thought because I'm not done with it. All right, so here I put this in here so you can see how the intercostal muscles kind of run the same direction as the oblique muscles do. And here we removed everything so you can see the transverse down here real nice. And then here's our inguinal ligament. Right there and right there. Now, aponeurosis. I don't think I've used that term yet. Aponeurosis is what you call a really broad, flat tendon. So the tendon of the internal oblique, the tendon of the external oblique, the tendon of the transverse abdominis, it all come together to form this rectus sheath. Those are all called aponeurosis, or I guess aponeurosis. But you have those, and there's really broad flat tendons. You also have one right down here in the lumbar spine, called rhacholumbar fascia. It's an aponeurosis. It's actually the tendons of the latissimus dorsi, where they also fuse with the external and internal oblique. And there's our angle oblique. All right. So now, kind of talking about our peritoneum, I'll come back to the stuff we had on the wall. Our peritoneum, we have structures that develop behind the peritoneum called retroperitoneum. We'll talk about that. But one of them is the liver. So you have this peritoneum stretching over the liver. And then the peritoneum, finding the abdominal cavity, strength goes up and runs underneath the diaphragm and then down the posterior part of the anterior abdominal wall.
Can you provide a definition for peritoneum?
It's just a bit. And you have this peritoneum stretching over the liver. And where it kind of runs up against the diaphragm, you have what are called coronae ligaments. That's just the peritoneum where it stretches up from the liver up to the other side of the diaphragm. And then you have what's called triangular ligaments. And that's just simply where the peritoneum changes direction. Now, here we have what's called the falciform ligament. Separates the two lobes of the liver. The liver actually develops and grows around a vessel, and so it kind of drives the peritoneum with it there as well. Now, all these ligaments right here, they are not true ligaments. They don't connect bone to bone. In fact, there's no bone involved at all. They just decided to call them ligaments so that they didn't have all the rules that we have nowadays. And but what this does is help support the liver, help pull the liver up against the diaphragm. The liver is pretty heavy, very dense. right here, you have the round ligament. The round ligament is also a field ligament. The round ligament is formed by the obliterated umbilical vein. So it runs on the backside of the abdominal wall down to the umbilicus. And that's how you exchange nutrients with your mom. Because all carbohydrate and protein go to the liver before everything goes. Once you're born, you obviously don't need that anymore. So it forms a little elevation on the backside of the abdominal wall called the round ligament. Now, just to make it a little bit more confusing for you, you have an extra little piece right here called the ligamentum teres hepatis. And what happens is the falciform ligament extends down and then makes a little sheath and wraps around the round ligament. Now it's just extra tissue, it doesn't do anything else. So in utero, what that did was help to hold the umbilical vein in place while you were exchanging nutrients with your mom through the liver. Now it's just a piece of tissue. So right in here is where the ligamentum teres hepatis is. You can see it right here. Then the round ligament continues down. And then here you can see our diaphragm, our coronary ligaments. Then right here are things change direction, wraps around the backside of the liver. There's our triangle ligament. So let's take a break. Yes.
How do you so good?
Hey, yeah. Hey, what's up?
I have to get this morning, so it was all over.
We're going to talk about circulation.
Yeah?
This is like, it's I'm about to say, I feel like this one. Yes, I do. This is like this one. That's it's getting better.
Like, I have to, and I find class where you need to
So this was after
it's roll. Yeah.
this was
It looks like you have an extra person.
well, this was a short life. This is I was here for 7 years. So it was
Well, I'm glad that you're up.
You like that?
No, I
It's just the you turn up. Thank you. She's still you look very sporty, very leisurely, but it looks nice. You also have a great yep. That's a lot of work. Feel a lot better. We're probably gonna have to review about so maybe Thursday. I'll tell you. I'm trying to. I watched the video, but I want to watch the videos. So, we'll see. So that way I can.
sorry. I
saw it. I don't know if
then it wasn't showing churches. Okay, like I'll restart the lockdown again, and then it went over again. Okay.
This thing here.
Run like a like done a big deep clean. Yeah. So I've done. It's been like maybe 2 months since I've like cleaned everything out. So I like with every class I like download PowerPoint. Really good. So I'm gonna go through and like clean up the computer and then update everything.
Bits and pieces that always
It's like what is this untitled document number 35? I have no idea. So I'm gonna go do that. This is the last thing I want to do next week. Thank you very much for
no, it's not your fault. You know, we did get it straightened out.
Yes, no, I agree.
We did the same thing last week.
That's just like
And the week before. And
that's the tat right here. That's the tat.
the practice tests as far as the practice tests show up and the first time, like, oh, big thing again.
Yeah, they, bro, I qualified for like 3
Well, I mean, the test will be next week. I'm so
scholarships
and I just
but then we're not getting
never wear like what I wore in lifting belts. Like, I'm like, you have problems. I don't wear lifting belts. Where's the teacher to stick with lifting belts? I'm so sorry. I just about like people getting lifting with their person, and then it just got out of hand, and I was just
that's probably why they probably don't.
yeah. The bench shirt, that's like a really tight tape. Yeah. No, I was just. I didn't know that. Like, it's not like there's
Make sure that you have everything.
I try to like keep my family like locked in. It was not
Let's put this starter back. Let's put this starter back.
She's so funny. Too obstinate.
So a lot, just based on you took the quizzes as well, right? Okay, so based on the quizzes, I've noticed that a lot of them are really like really focused on like certain topics. Like the first one on thoracic had a lot to do with T4 and things like that. Is the I guess it's a two-part question for the midterm. First, is the midterm gonna follow that, where it's just gonna be multiple choice? Like there's
You're
not
not
gonna
gonna
be
see a single question from, they're all multiple choice, yeah.
No, like-
But you're not gonna see a single quiz question.
Okay, but are there gonna be any visuals as well? Like, will you point anything out? Okay, okay. And then they're
As far as diagrams, that's good, right?
gonna describe as like their position, like anterior posterior. Okay. And then I had a second question. But like, so for the quizzes, what has been focused on the quizzes, because we've already taken a quiz on that, is it safe to say that we don't have to?
Not necessarily.
Okay.
I don't have, there's no way to cover this.
Right.
That's why we have, like on every side. There's no way to cover all of it.
Right.
So that's why we have. It's just all it's in.
Can we expect the midterm questions to resemble quiz questions, not the same questions, but be?
These multiple choice, yeah.
As far as like word structure and things.
Sure. Now, I did have some help writing some of those, and Dr. McIntosh is my reference. So some of the language of the quiz questions may not be exactly what I would. Pretty close. All right, so let's continue on with this. Now we'll talk about some nerves. We have on the back side of the abdominal wall, I'm not going to make a big deal about this now, we're going to cover it more thoroughly later on, but there's some of these nerves do come into play more. So we have this on the back side of the abdominal wall, coming out of the spine. We have what's called the lumbar plexus. So you have L1 through L5 spinal nerves. And they come together to form multiple nerves. And some of these nerves we're going to talk about this morning, and some of them we're going to talk about a little later. So first thing up here, we have T12 and L1 coming together to make the iliohypogastric and the ilioinguinal nerve. Iliohypogastric helps innervate the muscle of the anterior abdominal wall. Ilioinguinal nerve helps innervate the genitalia. So we're going to talk a little bit about the male genitalia this morning. We're not going to cover all of the male reproductive system. We'll talk about a little bit of genitalia and why. The scrotum and the fascias inside the scrotum are contiguous with the fascias of the anterior abdominal wall. And we're going to talk about that. And a couple of fascias associated with it. All right, so then we have the genitofemoral nerve right here, comes from L1 and L2. That innervates part of the male external genitalia. So that's why we're covering those nerves this morning. The rest of this we'll talk about later. This is for the thigh here, help innervate the make up the siding, things like that. We'll talk about the cutaneous stretches. So let's talk about real quick about sensation for the anterior abdominal. So, well, I talked about dermatitis. Yes.
For the genital femoral nerve, is the cremaster the only part of the?
Well, I'll get to that in a few minutes, okay? It does several. On the anterior abdominal wall, we have dermatomes as well. When I talk about dermatomes, the area of skin is innervated by a specific spinal nerve. So, going down through the rib cage, rib 8 is innervated by T8, so forth, like that. You follow that. Now, when you get down to the abdominal wall, T10 innervates the area around the umbilicus. T9, this upper portion right here. T11, just below the umbilicus. And T12 at the pubic symphysis. So that's what makes up the sensation for those areas. And part of that comes from the iliohypogastric and a little bit from the ilioinguinal, mostly the iliohypogastric. So nerves, we'll come back to nerves in a minute. I want to finish up the last little bit of the anterior abdominal wall. This is obviously a cross-section of the male external genitalia. So what you have right here, you have the penis, and right here holding the penis to the pubic symphysis, you have what's called the suspensory ligament of the penis. Then remember that scarpus fascia I was talking about a few minutes ago? Scarpus fascia continues down and becomes what's called the fungiform ligament of the penis, attaching the penis to the pubic symphysis and down to the top of the deep fascia of the penis to help support the penis as well. And we can see a little bit of our camper's fascia right in here. You notice it does not continue down into the belly. Now back to our peritoneum. Peritoneum covers the posterior wall and the anterior wall of the abdominal cavity, as well as covers the does not go down into the pelvis. Pelvic organs are not part of it. It drapes over the top of the pelvic organ, but not surround the pelvic organ like it does. So what you have right here, we're looking little bit of the pelvic organs right here. So we have the male, we have the bladder, and we have the rectum. Now, that peritoneum, kind of illustrated here in yellow, drapes down and covers the top of the rectum and covers the top of the bladder. And when it does that, because you have a little space between the rectum and the bladder, it forms a pouch. And that's called the rectovesicular pouch. And y'all are sitting there thinking, well, why the hell do we care? We're going to be paramedics. Why do we care what's going on at the bottom of the abdominal cavity? If you take a lateral lumbopelvic film, you're going to see it. Now, under normal circumstances, you're not going to see anything. You're going to see the small intestine a little bit of the large intestine. If they got gas, you'll see the gas in the parts. But you're not going to see it. However, if the patient has pericarditis, or something where they have an internal abdominal bleeding, or if they have some sort of infection that's making pus in the abdominal cavity, then what it will do, because this is the lowest point, and this seals off the abdominal cavity from the pelvic cavity, that stuff will collect right in here. And you take a lateral lumbopelvic film, you actually see that fluid on the film. You see the pus and egg, it's called exudate. Blood will show up somewhat, but exudate won't show. I've fortunately never seen a patient with it. I've seen pictures of it. So this is male. So you have what's called the rectovesicular pouch. Vesicular means black. All right. So now women, they obviously have a little more in the pelvis than we do. So they have a bladder, the uterus, and then they have the rectum. So women will have two pouches. They have the rectovesicular pouch, right back here, and the rectouterine pouch, right here. So you will see I have potentially two potential spaces for fluid to collect. Now, more likely than not, you will never see that. See any problems, most likely, hopefully you never. If you do take an X-ray and you find something floating around down here, call it. Don't do anything, you know, unless they'll call it. And they'll pay it. Okay. Now, here we have the stomach. Now we have another little piece of peritoneum, two little pieces of it right here. They're there for protection. The first one hangs down from the greater curvature of the stomach, and it's called the greater omentum. And what that does is protect the internal abdominal organ from the interior abdominal wall. Not only do you have this layer of peritoneum, but you have this fat pattern. So when you hear somebody talking about intra-abdominal fat, that's one of the types of intra-abdominal fat. So if somebody tells you they have 0% body fat, they don't know what to talk about. You have body fat. You may not have any subcutaneous. So that never goes away? No, never goes. You have subcutaneous fat that you can lose down to a certain degree. But as far as intra-abdominal fat, it's always happening. And the curvature around the nerve is called the myelin. So you absolutely have some fat. Now, up at the top of the stomach, going between the liver, you have what's called the lesser omentum in the liver and stomach. What that does is help support the stomach, and then also helps to cushion the stomach between the stomach and the vertebral bodies. This is all there for cushion. How many of you have ever heard your stomach? How many of you heard your stomach ground the last 15 or 20 minutes? Okay. Well, your abdominal viscera is constantly moving. And that's what causes some of that sound that you get that growls. And what the purpose is omentum, and the peritoneum, the front valve, the abdominal wall, it's supposed to it's going down because the GI
hospital.
If you don't have GI motility, then you can't process food properly. The GI tract is the long muscular tube, and constantly undergoing what's called peristalsis, when the food and it has to have room to move. Now, you also, it's nice to have an extra cushion out there, because how many times have you been hit in the stomach? Whether on purpose or by accident or whatever. Everybody gets hit in the stomach somewhere along the way from something. Somewhere in the place. So it'd be nice to have this extra cushion in there to help. All right, so inguinal canal. Now at the bottom of the abdominal wall, we have two openings called the inguinal canal. It is surrounded by the fascia of the external oblique and a little bit of the transverse abdominis as well.
Dr. Mark,
Yeah.
I just have one question about this line. So is that the coccyx that we're seeing there in the vertebrae
Where?
on slide? Yeah, right there.
Right there? That's fine.
So if you get in a car wreck, you've been in an accident,
Uh-huh.
and it's damaged, is it going to press against that pouch?
It's not going to press against pouch, it's going to press it. It's going to press,
He's asking about just the coccyx.
it's going to press against it.
Okay.
Yeah,
Would that then affect your bladder as well?
not bladder so much, but it would affect the patient. Now, the nerves by the bladder are compensating. So if you constantly damage, we'll have to safety and back to the, okay, inguinal canal. So the inguinal canal is an opening here at the bottom of the anterior abdominal wall. Now, what the inguinal canal is surrounded on either side by fascia. So you have the medial and lateral crease right there. It's bordered right here by the inguinal ligament. Now, the inguinal canal is there for a purpose. It is an opening for parts of the male genitalia to descend. So the testes develop on the posterior portion of the abdominal wall. And what they do right before you're born, or right thereafter, they descend through this inguinal canal down into the scrotum. They're drawn down there by a ligament called the throax. That's a silly little name, but it draws the testes down through the anterior abdominal wall down into the scrotum where it's long.
How do you spell that?
GEDMERCA. Look it up. What's called a throax causes the testes to descend. And when the testes are held in place by this little piece after you're born, is one tiny solution. Now, you ladies also have structures that pass through here too. You have what's called the round ligaments of the uterus, or ligaments anterior uterus. And we'll talk about that a lot later on. That's what actually helps support the uterus. Now, ligament anterior uteri makes its way all the way down to the inside of the lady uterus.
I have a question.
Also,
So, as women get older and the round ligament starts to dissipate a little bit, is it possible for the uterus to fall out?
women can have uterine prolapse all the time. There's a lot of different things that cause that. Normally it's postpartum because it does a lot of damage to all the circulation and stuff like that. But we're going to talk about that much more later on. Now inside with testes, you have what's called a chromatic cord. We're going to go over this like this.
Can you show us where's the round ligament compared to the inner ligament?
Well, the inguinal ligament is right here, and the round ligament will descend through the canal. You do have muscles inside of the testes and whatnot. We'll talk about those a little later on. And that's where I am going to stop for today, because I don't want to get into that.
Got a question. Question about is the direct
That's what it was about today.
Yeah, Jay. Yeah. It's a little fun. My fault, bro. My fault, bro. My fault.